I'm Jenna. I'll be your student nurse today. I'm just gonna do some hand hygiene. I'm gonna provide for privacy. Can you just state your name and date of birth for me? Okay, and do you have any allergies? Okay, let me just check your wristband there. All right, so I'm just gonna check the provider orders. So I'm gonna go check those. It looks like your provider ordered to do an IV, to start an IV. So that is what we will be doing today. I'm just gonna get my gloves set out as I will be needing those during this assessment. So I'm just gonna make sure my patient is in a nice and comfortable position. I'm gonna get all of my supplies. So I have all of my supplies laid out here, ready to go. I'm gonna check the expiration date on all of those and make sure those are good to go as well. So once I do all of that, I'm going to get my J-loop prepared and ready to go. So I'm just gonna go ahead and get that opened and get my flush. Once again, just checking the expiration date on my flush, and that is good. So I'm gonna take that off. And I'm just gonna flush through my J-loop. All right, once that's all prepared. So now I'm just gonna get my patient's arm in a dependent position. I'm gonna go ahead and put my tourniquet on. Now that my tourniquet's on, I'm just gonna check for a vein. So I found the vein that I want to use. So I'm just gonna go ahead, take my tourniquet back off. I'm gonna get my alcohol prep pad. And before I actually get that open, I'm gonna go ahead and put my gloves on at this point. So now that I have my gloves on, let's just imagine, I'm gonna take my alcohol prep pad. I'm gonna go ahead and I'm just gonna clean that vein off for 30 seconds that I had found. All right, now that I had got that, scrub that for 30 seconds. I'm gonna go ahead, I'm gonna put my tourniquet back up. While that's drying, I'm gonna go ahead and get my 20 gauge needle. So I'm gonna get that opened and my IV. All right, so I'm gonna go ahead, take out my needle. I'm gonna inspect the tip of my needle. So I'm gonna go and insert this bevel up. I'm gonna take my non-dominant hand, apply some pressure, and then I'm just gonna go in with my dominant hand into the vein, bevel up at a 30 to 45 degree angle. So once I do that, I'm gonna see some blood return. So once I see blood return, I'm gonna go ahead and lower my needle down to level. I'm gonna lower it about a 1/2 centimeter, and then I'm just gonna advance. I'm gonna go ahead and just advance that needle. And once I hear that click, I'm gonna just release my tourniquet. I'm gonna stabilize this. I'm gonna go ahead and remove that. And I'm going to hook up my J-loop. Once I have that in, I'm gonna flush that with like 3 to 10 cc's. So now that that is flushed, I'm gonna take my tourniquet and I'm gonna apply that just on my IV needle hub, not on the J-loop extension. And so once I have that there, I would then name, date, time on my Tegaderm. When I put this in, I'm gonna go ahead and dispose of my sharps in the sharps container. And I'm just gonna make sure my patient is comfortable and my supplies are cleaned up before I head on out of here.